First of all, I want to start with a few acknowledgements. I want to particularly acknowledge the Royal College of Physicians and Frank Murray for allowing us to use this building for the launch, but also for their advocacy and their support in getting us this far and to this point. I also want to acknowledge one of my parliamentary colleagues, Senator Melda Henry, who's here, who's been very supportive of some of the actions in this bill for quite some time, as have most of my colleagues. I want to thank Alcohol Action Ireland and the NGO groups as well, all public health advocates, the Faculty of Public Health, and I see Dr. Joe Barry is here for their advocacy down the years on this issue, and also some of the members of the original Substance Misuse Strategy Group are here too. And I just want to particularly acknowledge their presence. It is a great pleasure, after 5 years of discussion, debate, working groups, senior officials groups, working papers, Attorney General's advice, cabinet subcommittees and cabinet meetings, to be able to formally launch the Public Health Alcohol Bill, which is Ireland's first public health legislation on alcohol. Ireland, as we all know, has an unhealthy relationship with alcohol. We'd like to believe that alcohol is misused by a small minority of people who drink irresponsibly. Unfortunately, that's not true. Most Irish adults drink too much. Most of us, or a lot of us, binge drink very often. And of course, quite a lot of children engage in drinking alcohol as well, which is of particular concern. The purpose of this bill is not to cancel Christmas or to ban alcohol outright or anything of that sort. We're not a nanny state. And we're not trying to treat alcohol as though it were something like tobacco, which is a universal harm. But the purpose of this bill is far-reaching. It is to change our relationship with alcohol, to reduce alcohol consumption in Ireland to the Western world average, and to reduce binge drinking considerably. And I do hope that this bill, this new law, this legislation, represents a turning point in Ireland's relationship with alcohol. This legislation is life-saving and life-improving. It will result in reduced attendances at our emergency departments, particularly at weekends. It'll reduce the incidence of cancer. It'll reduce obesity, liver disease, and gastrointestinal disease. It will result in fewer suicides, fewer assaults, fewer sexual assaults, less child neglect, reduced road traffic collisions, reduced absenteeism from work, and reduced workplace accidents. So I think when you consider all of those things, you can see how important this legislation is and how it goes well beyond health, because the harms of alcohol don't just affect us in health, they affect us in terms of public order, justice in the workplace, and in so many other ways. The major provisions of the bill you'll be aware of. First of all, there's legal provision for minimum unit pricing. What that is a new law to eliminate very cheap alcohol, particularly from our supermarkets. And we're setting that price at 10 cents per gram, and that's in the legislation and can be varied upwards subsequently by the Minister by order. We know particularly young people are very price sensitive, and we know from excise and cigarettes being increased over the years that if you raise the entry point, the cost entry point, fewer young people will start drinking or smoking, and also people will consume less in terms of volumes. In bringing in that legislation, we do, of course, have to have regard to what happens in Northern Ireland. Ideally, we want to introduce minimum unit pricing at the same time as Northern Ireland, so as not to create cross-border trade distortions. And also, we have to have regard to a decision of the European Court of Justice, which is anticipated in the next few weeks. What we anticipate that judgment to say is that we can go ahead with minimum unit pricing, provided that we show that it can be more effective than any other measure, and we're already preparing the case to do that, because as we do know, as we speak in Ireland at the moment, there are supermarkets selling cans of beer for 43 cents at or less than the excise charged on them. So we know that minimum unit pricing will be a more effective measure than excise or below cost selling, and we believe we can make that case strongly in the courts if we need to. The bill also provides for structural separation in retail units. It doesn't apply to pubs and off licences, but to any mixed retail unit, alcohol won't be sold as a normal product. It'll have to be in a separate part of the store, in a cabinet or behind a partition. It's not required to have a separate till or to have a wall, but it does need to be in a separate part of the shop, not on display in the way it is currently. And it certainly has to be at the back of the shop, if you like, so that people don't have to walk through it just to buy their ordinary groceries, which is very important too. It also provides legal provision for labelling, so alcohol will have to carry information on how many calories are in alcohol. At the moment, you know exactly how many calories are in a packet of potato. You don't know that for the alcohol you're consuming, and you should, because of course it is a major contributor to obesity. Also warnings about pregnancy and warnings about health. And there'll be a 3-year transition period during which that new labelling will be introduced. There are new restrictions on advertising, particularly about place. It will not be permitted to advertise alcohol in the vicinity of a school or publicly operated park or playground, on public transport, or in the case of sport, on the pitch itself or on the goalposts, although it will be permitted to have advertising in stadiums, but at a maximum of 20% of the advertising space available. Advertising will only be permitted in cinemas for over 18s movies, and also will be prohibited on children's clothes. The advertising restrictions do apply online, but obviously don't apply to websites operated outside of Ireland. And we do strongly agree that it would of course be preferable if we did all these things on a European or international basis, but we can't afford to wait for Europe to act, and we need to show leadership. And we did that before when it came to the workplace smoking ban, on the plastic bag levy, and so many other things. And we've taken the decision to lead on this rather than to wait for everyone else to act. As part of the BAI regulations, there'll be a watershed for advertising alcohol, and that's anticipated to be at 9 p.m. That's not in this legislation, it's in BAI, Broadcasting Authority of Ireland rules. As we were developing the legislation, we moved more and more to a space whereby we were talking not just about where advertising was allowed and where it wasn't, but also what the nature of the advertising would be. And the legislation provides for advertising of alcohol products that don't glamorise alcohol. So any advertising can talk about the product, how it is brewed, how it is distilled, where it comes from, what's in it, how much it costs, all of those things, but cannot glamorise it, cannot make out that somehow consuming this product will make you better at sport, will make you good at music, or more attractive to the opposite sex or the same sex if you're so inclined, or anything like that. And they're the kind of restrictions that are going to be put in place. So I was told not to give any brand examples, but I will, because I'll give you an example of a good one and a bad one from the same brand. This will not outlaw the Guinness Christmas ad, which shows James's Gate and a bit of snow, and telling you this is the home of the black stuff, because it is of course black stuff. That is true, and it does come from St James's Gate Brewery. However, what will not be permitted is an ad for Guinness that seems to suggest that you've a life choice between being a Springbok or a gangster, and somehow Guinness is associated with that. So that sort of advertising obviously will not be permitted, nor will any advertising suggesting that consuming a product will somehow make it possible to score a conversion or kick a rugby ball, or play a musical instrument, or do any of those type of things which you often see in advertising. What will of course be allowed is telling you that the cider comes from an orchard, this is where our apples grow, or for example that this whiskey was distilled in this family distillery that's been here for 300 years. All that is okay, but what's not going to be permitted is any glamorization, and that's very clear in the legislation. Crucially, of course, it is legally enforceable and legally binding through the environmental health officers, who are currently the people who go around inspecting restaurants and shutting them down from occasions and enforcing the sunbed legislation. So it'll be enforced through that, and also through the courts as need be. And that's very important, because we do have existing codes of practice, and they will remain, but they're not legally enforceable. This primary legislation is. I don't think this legislation should be seen in isolation. It is, of course, part of a package of measures that are underway and have to be done over the next number of years. Things that we don't need to legislate for, but things that we do need to do. So, for example, educating people about the risks of alcohol, giving people public information, providing addiction services, access to those services, and of course making sure that we have appropriate licensing laws and they're enforced. They're not in this legislation, and most of them don't have to be legislated for, but they do need to be done. But this legislation will play a big part in all of that. What's also written into the legislation is a review after 3 years. So the intention is to get this legislation through, certainly by the middle of next year, to enforce and bring into force all the measures over a year or two after that, and then review everything at the end of the 3 years and see what difference it has made and whether we need to take other measures at that point. So once again, thanks very much to all of you who have been supporting this and have made this day possible, and particularly want to thank colleagues and others for their contribution to this bill to date, and I really look forward to all party support and its speedy passage through the Dáil and Seanad. Certainly would like to get it through at least one of those two houses before before one of them is dissolved. So I'll now hand you over to the Chief Medical Officer, Tony Hoolan, who will give a presentation and tell you some more about the details of the law. But I particularly want to acknowledge his presence here and that of Geraldine Luddy, who've been working day and night on this legislation when they haven't been working on everything else. And I really do appreciate their assistance and the enormous work that they and their division have done on this really important legislation. Thank you.